Good afternoon, everybody. This is Steve May from American Senior Benefits. Thanks for tuning in to Care About Your Health Network. Today, we are going to be discussing basic Medicare. I believe that when people are getting ready to turn 65 or unfortunately become disabled, that they're going to have to understand Medicare in order to make sure that they are protected when it comes to their health insurance. The first basic thing that you need to understand is how does Medicare work, and in subsequent videos, we will discuss the additional plans that will work with Medicare to make sure that you're protected. Let's get started. Medicare has two components to it. There is Medicare Part A, which is hospital, and Medicare Part B, which is doctors. Let's begin with discussing Medicare Part A. Medicare Part A strictly has to do with hospital. And to break it down really basic, it's 3 hots and a cot. That means when you go into a hospital, you have certain deductibles that you're responsible for and certain co-payments after a certain period of time. When you automatically go into a hospital, you have a $1,408 deductible. Whether you're in there for 1 day or you're in there for 10 days, that $1,408 is responsible by you. Now, say you have an extended stay in the hospital. That $1,408 will pay for the first 60 days in the hospital. If you are in there for day 61 to day 90, then you will have a $352 deductible per day while you're in the hospital. Now, if for some reason you're in there after 90 days, it increases to $704 per day until up to day 100. If for some reason you're in the hospital after 90 days, from day 91 to day 150, you will have a $704 copay per day in the hospital. Now, after 150 days, you will pay 100% of the bills. So if you have Medicare Part A, that is what they will pay, and that is what you will be responsible for. The next part that we're going to discuss is Medicare Part B. Part B has to do with doctors. Now, that is a pretty expansive one. It's not like hospital. It has to do with doctors' visits. It has to do with surgeries. It has to do with testing. It has to do with MRIs, CAT scans. Anything that has to do with a doctor falls under Medicare Part B. Now, for Medicare Part B, you do have, as of 2020, $144.60 a month payment for Medicare Part B, and normally it is taken out of your Social Security. Once you have that, you will now have Medicare Part A and B. Medicare Part A we have discussed. Medicare Part B, you pay $144.60. And then after that, Medicare covers 80%. You will be responsible for 20% of the bill. Not bad for $144, but if your bill is $100,000, you're left with a $20,000 check that you're going to have to cut. Let's also get into some of the copays, which there's only one for Medicare Part B, and that is a $198 copay. Once that $198 is covered, then you will pay a straight 20% of everything that you have to get done. In the upcoming videos, we are going to discuss the additional plans that you'll be able to get that will work with Medicare to either decrease or eliminate most, if not all, of those copays, deductibles, and any worries that you're going to have. You have a terrific day, be safe, and looking forward to seeing you again. If you have any questions, please put it in the comments below. But if you are getting ready to turn 65 soon and you want someone to help you now, go ahead and contact us by calling the number provided. Email us from our email address. We will get in touch with you and we will make sure that you are protected. Have a great day and talk to you soon.